There is a conversation happening in millions of homes right now that almost nobody is having with their doctor. An older adult opens a cabinet, sometimes a very full cabinet, lines up a row of bottles on the kitchen counter, and begins the morning ritual of vitamins and supplements. Vitamin C for immunity, vitamin D for bones, a multivitamin for good measure, maybe something extra for energy or joint support. It feels responsible. It feels proactive. And in many ways, the intention behind it is genuinely good. But here is what most people are never told. After the age of 60, certain vitamins and supplements that are considered perfectly safe for younger adults can place a burden on aging kidneys that quietly builds, month after month, until the damage becomes impossible to ignore. And the most unsettling part? The supplements causing the harm are often the very ones sitting in the most trusted, most widely recommended bottles on that counter. Well, I'm Dr. Naira Stein, Senior Health and Wellness Consultant, and if you're over 60 and you take vitamins regularly, even ones prescribed or recommended by someone you trust, I want you to stay with me today. This is not about frightening you away from all supplements. It is about giving you the specific, honest information you deserve so that what you take every morning is genuinely helping you, not slowly working against the organs that keep everything else running. Your kidneys have been quietly protecting you for decades. Let's make sure you're protecting them right back. Before we get into the 3 vitamins, I want to spend just a moment on why the kidneys are so uniquely vulnerable to supplement-related harm after 60. The kidneys age. This is a biological reality that no amount of healthy living entirely prevents. From around the age of 40, the kidneys gradually lose a small percentage of their filtering capacity each decade. Blood flow to the kidneys diminishes. The number of functional nephrons, those microscopic filtering units, roughly 1 million in each kidney, decreases over time. By the time a person reaches their 60s and 70s, their kidneys may be operating at 70 or even 60% of the capacity they had at 30, while still producing perfectly normal results on standard blood tests. That last point is critical. Normal blood work does not always mean full kidney function. The blood test most commonly used to assess kidneys, creatinine, and the calculated GFR, or glomerular filtration rate, can appear reassuring even when meaningful filtering capacity has already been lost, because the body compensates quietly for a long time before the numbers shift. This means millions of older adults are walking around with kidneys that are already working harder than they appear to be, taking supplements without any awareness that their organs are less equipped to handle those compounds than they once were. And when a vulnerable kidney meets the wrong vitamin in the wrong dose, the consequences can unfold slowly and silently until they become very loud indeed. Let's begin with the first vitamin, and I want to approach this one with particular care because it has an almost universally positive reputation. Vitamin C. For most of living memory, vitamin C has been synonymous with health. Immune support, antioxidant protection, skin health, collagen production. The list of its genuine benefits is real and well supported by research. For most healthy adults taking reasonable amounts, vitamin C is safe, helpful, and worth taking. But when older adults begin taking high-dose vitamin C supplements, and what the supplement industry often packages as a standard dose can be remarkably high, the kidneys become the unwilling recipient of a problem that most people never anticipate. Here is what happens inside the body. Vitamin C, once absorbed and used, is metabolized into a compound called oxalate. Under normal circumstances, the kidneys filter oxalate from the blood and excrete it in the urine without difficulty. Amounts of vitamin C are consumed regularly, doses of 1,000 milligrams or more per day, which are common in many commercial supplements and sometimes recommended casually for immune support. The amount of oxalate generated can exceed what aging kidneys can comfortably manage. Oxalate that builds up in the urine has a strong tendency to bind with calcium, forming calcium oxalate crystals. These crystals are the most common component of kidney stones, and if you have ever spoken with someone who has passed a kidney stone, you will understand why this matters. But it goes beyond stones. In people with already reduced kidney function, excess oxalate can deposit directly into kidney tissue, a condition called oxalate nephropathy, causing progressive, cumulative damage to the filtering structures themselves. Research has shown that high-dose vitamin C supplementation is associated with a meaningful increase in kidney stone risk, and in those with underlying kidney vulnerability, with measurable declines in kidney function over time. The recommended dietary allowance for vitamin C in adults is 75 to 90 milligrams per day. The tolerable upper limit, the point beyond which risk begins to rise, is set at 2,000 milligrams. Yet many common supplements deliver 500 to 1,000 milligrams in a single tablet, and some enthusiastically marketed products push far beyond that. For a 60 or 70-year-old with kidneys already working below their peak capacity, daily high-dose vitamin C is a quiet but persistent source of harm. The good news is simple. If you enjoy vitamin C supplementation, speak with your doctor about dose. A modest supplement of 200 to 500 milligrams, or better yet, getting your vitamin C from whole food sources, bell peppers, citrus, strawberries, broccoli, delivers the benefits without the oxalate burden. Your kidneys can manage what nature packages. It is the concentrated, isolated, high-dose supplement form that creates the problem. Now let's talk about the second vitamin, and this one requires us to spend a little time with nuance, because the conversation around this particular supplement in recent years has been almost entirely one-sided, and older adults in particular have been encouraged to take it in amounts that deserve far more scrutiny than they typically receive. I'm talking about vitamin D. Vitamin D is genuinely important. It supports bone density, immune regulation, muscle function, and mood. Deficiency is real and common, especially among older adults who spend less time outdoors and whose skin produces vitamin D from sunlight less efficiently than it once did. Supplementing with vitamin D is often appropriate and sometimes necessary. I am not here to tell you that vitamin D is dangerous across the board, because it is not. But I am here to tell you something that is almost never mentioned in the enthusiasm surrounding this supplement. Vitamin D toxicity is real. It is more common than most people realize, and when it occurs, the kidneys bear the heaviest cost. Here is the mechanism. Vitamin D, when taken in excess, raises blood levels of calcium. This process, called hypercalcemia, does not happen from mild supplementation, but it absolutely occurs when people take high doses for extended periods. And high doses, in this context, means anything above what your doctor has specifically measured and recommended based on your actual blood levels. The challenge is that vitamin D supplements are sold over the counter in doses of 2,000, 5,000, and even 10,000 international units, and many older adults take them daily for months or years without ever having their blood levels checked. Some take multiple products containing vitamin D simultaneously without realizing the doses are stacking. When calcium levels rise too high in the blood, the kidneys respond by trying to excrete the excess. They work harder. The collecting tubules, the delicate channels through which filtered fluid passes before becoming urine, can become damaged by the calcium load passing through them. Over time, calcium deposits can form within kidney tissue itself, a condition called nephrocalcinosis. Blood vessels within the kidney stiffen and narrow. Filtration efficiency drops, and because all of this happens gradually and painlessly, people continue taking their vitamin D faithfully every morning, certain they are doing something good for their bones, while their kidneys absorb a burden that is compounding beneath the surface. There is also an indirect pathway through which excess vitamin D harms the kidneys. Elevated calcium in the blood increases the risk of kidney stones, the same calcium oxalate stones we discussed in relation to vitamin C, and also calcium phosphate stones. For an older adult already taking high-dose vitamin C and high-dose vitamin D simultaneously, the risk multiplies in ways that neither supplement alone would produce. The right approach to vitamin D is simple, but requires one step that too many people skip. Get your blood levels tested. A 25-hydroxy vitamin D blood test tells your doctor exactly where your levels stand and whether supplementation is warranted at all, and if so, at what dose. Most people who are genuinely deficient do well with 1,000 to 2,000 international units daily under medical guidance. Some need more, and their doctor will know that based on their levels. What nobody needs is an arbitrary high dose taken indefinitely without monitoring. Your kidneys deserve better than that. And now the third vitamin, or more accurately, the third category, and this one surprises people most consistently because it sits at the intersection of two things older adults are actively encouraged to prioritize: bone health and digestive comfort. I'm talking about calcium supplements, and specifically the way they're often taken alongside vitamin D and in combination with the dietary calcium already present in a well-intentioned diet. Let me be direct. Calcium is an essential mineral that your body cannot produce on its own. After 60, bone density matters enormously. Falls and fractures can be genuinely life-altering events for older adults, and the fear of osteoporosis is legitimate and understandable. The supplement industry has responded to that fear with a vast array of calcium products: calcium carbonate, calcium citrate, chewable tablets, combination formulas, and older adults have been told for years that taking these supplements will protect their bones. The reality, as research has shown with increasing clarity, is considerably more complicated. When calcium is consumed through whole foods, dairy products, leafy greens, fish with soft bones, fortified foods, it arrives in the body alongside other minerals and compounds that help regulate its absorption and distribution. The body absorbs what it needs, and the kidneys handle the rest in a measured, manageable way. But when calcium arrives in the concentrated, rapid-release form of a supplement, particularly calcium carbonate, which is the most common type and the least well absorbed, the dynamics shift. Blood calcium can rise sharply after a supplement dose. The kidneys are flooded with more calcium than they can elegantly process. In older adults with even modest declines in kidney function, repeated calcium supplement doses contribute to elevated urinary calcium, a condition called hypercalciuria, which dramatically increases the risk of calcium kidney stones. Studies have shown that postmenopausal women taking calcium supplements have a significantly higher rate of kidney stone formation than those who obtain their calcium from food alone, even when total calcium intake is similar. The supplement form, not the calcium itself, is the primary driver of the problem. Beyond stones, chronically elevated calcium passing through aging kidneys contributes to the same tubular damage and calcium deposition in kidney tissue we discussed with vitamin D excess. And when someone takes both a calcium supplement and a high-dose vitamin D supplement at the same time, as is extremely common because many bone health products combine them, the combined effect on kidney calcium load is greater than either alone. The kidneys are managing the consequences of a double burden that the person taking these supplements is almost certainly unaware of. There is also an important cardiovascular dimension to excess calcium supplementation that is worth mentioning because heart health and kidney health are deeply interconnected in older adults. Research has raised serious questions about whether large doses of supplemental calcium increase the risk of calcium deposits in arterial walls, a form of vascular calcification that accelerates cardiovascular aging and further strains the kidneys, which depend on healthy blood flow to function well. This is an active area of scientific discussion, and it underscores why calcium supplementation in older adults genuinely warrants medical oversight rather than self-directed dosing. The practical guidance here follows the same principle as the others. If your doctor has assessed your bone density and determined that calcium supplementation is necessary, work with them to identify the right dose and the right form. Calcium citrate is generally better absorbed and gentler on the kidneys than calcium carbonate. And take it with food, in divided doses, to reduce the peak calcium load reaching your kidneys at any one time. If you have not had a specific discussion with your doctor about whether you need a calcium supplement at all, prioritize getting your calcium from food first. A cup of plain yogurt, a serving of leafy greens, a small tin of sardines. These deliver calcium in a form your body handles far more gracefully than any tablet. What I want you to walk away with today is not anxiety about your supplement cabinet. I want you to walk away with one clear and empowering thought. The question is not whether vitamins are good or bad. The question is always whether the right vitamin, in the right dose, at the right time, is appropriate for your individual body at this stage of your life. And that question deserves an honest, personalized answer, not a blanket recommendation made for a younger, fully functioning kidney. Your kidneys don't send warning letters. They don't schedule appointments to tell you they're struggling. They simply keep working, quietly absorbing whatever you ask of them, until one day they can't absorb any more. By then, the window for easy intervention has often passed. But right now, today, you have the opportunity to look at those bottles on your counter with informed eyes, to ask questions, to have a conversation with your doctor about your actual vitamin blood levels, your kidney function, and what your particular body needs, not what a label suggests, not what a well-meaning friend recommended, not what a television advertisement made sound essential. You have spent a lifetime building your health. These years deserve the same care and precision you would give to anything else that truly matters. Your kidneys have been faithful to you. Give them the protection they've earned, starting with what you put in your hand every morning before you swallow it.